Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Jinesh Kumar Jain, consultant cardiologist, Urmila Memorial Hospital, Raipur. Today we are speaking about a silent epidemic that is spreading across India, which is heart failure. So, unlike the Western countries where heart failure is predominantly a disease of elderly, the majority of patients in India with heart failure are young individuals. So, let's break down 5 essential insights into the heart failure. Firstly, what does it mean when a doctor tells you that you have a heart failure? So, when people are diagnosed with heart failure, they think it is the end of their life or their heart is about to stop. The term heart failure simply means your heart is struggling to pump blood as efficiently as it should. Secondly, why are so many Indians affected by heart failure? So, genetics plays a very important role. Indians are genetically more vulnerable to cardiovascular disease. Furthermore, there is a high burden of hypertension, diabetes, obesity, and smoking, which has worsened this epidemic. Moving on, what are the signs and symptoms of heart failure? So, people can present with complaints such as shortness of breath, difficulty in breathing, generalized weakness, pedal edema, decrease of appetite, and even mental confusion. So, these are the symptoms of heart failure. If you have any such symptoms, you should contact your healthcare provider as early as possible. How can we protect ourselves from suffering from heart failure? So, our heart works incredibly hard to keep us alive. There are 5 golden rules which we can follow to ensure that heart doesn't end up with heart failure. First, we should incorporate healthy diet, which is rich in fruits, vegetables, and whole grains, and avoid sugar and processed foods as much as possible. Second, we should incorporate daily exercises into our routine. Third, we should quit smoking, alcohol, and tobacco as early as possible. Third, we should practice stress management techniques and take adequate rest. And lastly, by routine checkup, which includes ECG, echo, and blood tests, we can detect heart failure at very early stages. So, what comes next once heart failure diagnosis has been made? Thankfully, there are multiple treatment options. There are medications which can prolong our life. Second, there are devices like biventricular pacemaker, implantable cardioverter defibrillator, and options such as operations including heart valve repair or replacement. Last of all, we can also consider for heart transplant. Remember, awareness and proactive measures against heart failure are key in combating against this silent epidemic. Thank you.